Hi, I'm Dr. Hale. This is a video for our patients on when is it time for an orthotic checkup. Again, I'm Dr. Hale. I work at the Foot and Ankle Center of Washington. I also work with Dr. Lawrence Huppen and Dr. Milad Kashani. We're podiatrists in Seattle, and we specialize in evidence-based non-surgical treatment of foot and ankle conditions. Patients often ask why and when should orthotics be checked. So orthotics should be checked when their cushion starts to wear out, their accommodations are wearing out, or the shell has flattened or cracked. Also, if your feet have changed or you've gained any weight, since when you gain weight, it also makes the orthotic less supportive. Or if you have new or returning symptoms, and also if it's just been a long time, usually we check at least between 2 years to 5 years. Patients also ask when do they not need the orthotic check. Of course, if you're doing great and you have no holes in your orthotic cover. Also, if you want to order additional pairs, if less than 3 years, you can just give us a call at the office or you can send us a message through our online portal. Of course, the cover, which is the softest part of the orthotic, wears out the fastest. If you notice any excessive wear areas or holes, you need to have your cover refurbished. You can see your doctor. If you don't have a doctor, you can look at an online company such as orthorestore.com. If you notice harder areas in the bottom of a orthotic, sometimes made out of cork, these are called accommodations. These can also wear out. You don't always have to replace the cover if your accommodations wear out. So if you need a new accommodation, again, follow up with your doctor or see someone online. If the shell of your orthotic has cracked or flattened, this will cause decreased support and sometimes lead to symptoms. If you notice this and you have no pain, you don't necessarily have to do anything. However, if you have increase in symptoms, we need to modify the current orthotic or replace your orthotic. If your symptoms have returned, we look for possible problems such as your orthotic has changed, your feet have changed, your body has changed, including pregnancy, weight gain, and even age. The solution is for an updated treatment plan from your doctor, modifying your current orthotic, and replacing your orthotics. Patients come in with very old orthotics, and sometimes if you're doing fine, we may not need to make any orthotic changes. However, we want to be preventative, so make sure your shoes are not worn out, your orthotics are not worn out, but we also change over time, so sometimes we need new accommodations or additional modifications such as cushioning. Cost and time of the refurbishment depends on the complexity of the modification. Sometimes this can be done in the office and sometimes they have to be sent to the lab. If you need any more information and you're in the Seattle area, check out our website at footankle.com. If you are not in our area and need your orthotic modified, contact OrthoRestore online. If you felt this video was informative, please click to subscribe and thanks for watching.